Good morning po, sir. I'm Katie Comanda, President Nurse for today. So, for verification po, sir, can I ask what is your name?
I am Alran
Hi, sir. How about your birthday po?
July 25, 2000.
Okay, sir. Age po?
21.
Okay, sir. So, by the way, sir, how would you like me to call you today?
Call me Mr. Han.
Okay, sir. Okay po. Okay, Mr. Rahar, I have come to check on you and conduct a heart and sacral vessel assessment. This assessment is important for us to assess your cardiovascular system, particularly your heart and vessels, and check for their condition, which will help us know if you have any cardiovascular problems and issues. Is that alright with you, sir?
Okay.
Okay po. So, when I'm conducting this assessment, all you have to do is relax and do what I tell you. Okay, sir? Okay, Mr. Kahar, I'm going to close the curtain to make you feel more at ease and to prevent any interruption while we are doing the assessment. Is that okay, sir?
Okay.
Okay, Mr. Kahar, I would like to ask you a few questions first. Is that alright, sir?
Okay.
Okay. Do you have family history of incidents of heart disease, sir, or congenital heart disease?
No.
High cholesterol levels po?
No.
High blood pressure or hypertension po?
No.
May na-stroke po ba sa inyo?
Wala din.
Okay. How about arterial disease po?
Wala din.
Okay. Do you also have any history of heart murmur?
Wala din.
How about heart attack po?
Wala din.
Varicositis po?
Wala.
Heart failure po?
Wala.
How about any symptoms of heart disease po?
As for now, wala akong nararamdaman.
So do you also have any disease that may cause some effects on your heart?
I think wala din.
So how about your lifestyle habits po? Do you often eat fatty foods or are you smoking po?
Hindi ako nag-smoke. Paminsan kumakain ako ng karne. Pero
Okay.
hindi naman madalas.
Okay. So thank you, Mr. Kahar, for answering all my questions. Okay, Mr. Kahar, can you lie down properly for our assessment to start?
Okay.
Okay, let's assume that the patient already changed his clothes into a patient gown. Okay, so I'll begin with the assessment by simultaneously inspecting and palpating the precordium for the presence of abnormal pulsation, lifts, or hips. The precordium is the front of the chest wall over the heart, and while inspecting, I should observe for any presence of surgical scars, visible pulsation, wound or lesion, and chest deformity. And I should also observe for the patient effort of breathing, if it is really labored, and if he's using those accessory muscle to breathe. Sir, I'll start as inspecting and palpating your precordium. Pwede niyo po bang mababa yung neck of your shirt? Okay, sir. I'll start palpating po. Ayan po. Okay, sir. Ngayon naman po, sir, pwede niyo po bang mataas yung shirt niyo, sir? Don't worry, I'll cover you po. Yan lang po, sir. Okay po. Okay, sir. Okay, thank you po. First, I will inspect and palpate the aortic and pulmonic areas. I will stand and observe at the angle to the side and will take note if there are any pulsation. I will palpate lightly if there is any tenderness and for chills, which are abnormal vibration. Okay, sir? Thank you palpate now, Mr. Kahar. Can you lift up your shirt, sir? Don't worry, I'll give you privacy. Okay, sir. Now I'm going to palpate na po. Sir. Now I'm going to palpate because palpate the percuspid area. Sir, can you lift up your shirt? Okay po. I will examine and palpate the apical pulse for pulsation. If it's shifted laterally, I will use the centimeter ruler to measure the distance between the apex and the mid-clavicular line. Auscultating the precordium is crucial because it allows us to detect and recognize distinct hard sounds as well as determine if there is any apical sound that could suggest a problem with the patient's heart. Okay. After successfully inspecting and palpating the precordium, I will now proceed with auscultating the heart in all four anatomic sites. Start auscultating by using the diaphragm of my stethoscope. Okay, sir. Can you lift up your shirt, sir? Okay. Kahit huwag na po sa Now, I'll need to palpate the carotid artery with extreme caution. To palpate the arteries, I will ask the patient to tilt his head to the side at a 45 angle, which will allow me to see and palpate the artery properly and easily. Will it be okay, Mr. Kahar, if you tilt your head to the side, on the right side? Okay. Now, I'm going to proceed in palpating the artery of both sides. After palpating, I will proceed to auscultate both sides of the carotid artery. To accomplish this, I have my patient tilt his head at a 90-degree angle for better auscultation. Mr. Kahar, I would like you to turn your head on the side. Okay, a little more, sir. Okay. Now, I'm going to begin auscultating. How about that side, sir? Okay, now I'm done auscultation, both carotid artery. Auscultation and palpation are used to evaluation the carotid arteries. This test determine heart function as well as the quality of blood flow via the artery. Okay, sir, to complete our assessment, I will now be performing the inspecting of the jugular veins for any distension. To accomplish this, I will need my patient to position in a semi-fallen position with the head supported by a small pillow. Sir Kahar, allow me to help you in positioning in a semi-fowler position, since it will help us inspect your jugular veins. Is it okay, sir? Okay po. Thank you, sir. Okay, sir. Atin pala kunin yung isang inimit ko pala, sir. Now, is it going to inspect the jugular veins? After the assessment of the heart and central vessels, you should not forget to wash your hand to prevent any microorganism or bacteria. Okay, all done now, Mr. Kahar. We are done assessing your heart and central vessels. So, how are you right now, sir?
Okay.
Okay. Do you feel any discomfort po?
Not at all.
Okay, I see. So, now since we have completed the assessment, I will just record all of the data and information we gathered. Okay, sir? Mr. Kahar, based on our assessment, the lift of your external chest is normal, and also with no lifts, heaves, or thrills. And your apical impulse is located to in fifth interspace just internal to mid-clavicular line, which is normal. Okay, sir, so the rate and rhythm of your heart are both normal. I didn't hear any strange cardiac sounds either. There is no carotid groove in either of your carotid arteries. Your carotid pulse is also smooth, and there is no distension in your jugular veins. So, all in all, everything is normal, Mr. Kahar. Mr. Kahar, thank you for your cooperation during our assessment. If you need something, just ask for a nurse within the hospital. Okay, sir? Okay, thank you po.